A diagnosis of cancer comes with many questions, and understanding your options and your best course of treatment is a process that takes careful time and attention. Wouldn't you like a doctor who puts your concerns first and provides the information you need to make an informed decision? Knowing that you have the very best care and the most advanced technology available can make a big difference. What questions do you have, and how do you find a doctor and the course of cancer treatment that's right for you? This short video, presented by Health Connections at wwlp.com, will introduce you to oncology specialist Dr. Philip Glynn, offering a full spectrum of cancer treatment services and the expertise that comes with over 18 years of leading oncology care.
When a patient first comes into the office, it's important to collect all their information. A vital part of what we get trained to do as oncologists is to assess the extent of disease. But I think what's incredibly important, particularly for people who are going to go into active treatment, that they have a good knowledge base of not only what their disease is, what their treatment options are, but what their realistic expectations can be.
My hope is that when someone starts chemotherapy, that they have all the information that they need, that they feel comfortable with the doctor and they feel comfortable with me or Cindy, and that they're comfortable with the plan before we begin.
One of our goals is to get a new oncology patient after original diagnosis or after their surgery within a call to this office within 7 days. It just alleviates that stress and the unknown of what comes next after they possibly have had surgery. And then once they have been seen, it's facilitating testing to determine any more extent of the disease, and that's critical. That you can't wait 2 to 3 weeks for. These people are scared and they want to move on and they want to start treatment so that they feel like they have an active process in this disease.
We try to make this as comfortable a place as people could possibly expect to go to get chemotherapy. There's an outstanding staff of people who are very sensitive to what somebody's going through when they're in the middle of a cancer experience. The nurses that work here have excellent credentials and years of experience and skill.
They are patients, and they are, they're taken care of as patients should be. But here we like to treat them like there's a lot of laughing on this floor. You wouldn't expect that in an oncologist's office. Yes, there's a lot of seriousness too, but we like to treat them like they're a member of this practice.
And my hope and what I tell patients is that there are no stupid questions. They should ask us anything they want to ask us. If they think of a question after they go home, they should call us. That we would rather take a phone call and help relieve their anxiety or answer a question or triage their symptoms than having them sit home and be worried about something.
Whenever I have had to call in, I get someone right away. It's just worked out really well for me. It's convenient too, and they've worked around a schedule for me because I wanted to get back to work at least part-time. So they've worked around my schedule to some degree, and there's a lot of flexibility, which has helped me out a lot.
They are a member of our family when they're treated here. We get to know their children, their spouses, the friends that come with them.
And I like the fact that it's a small setting. Everybody knows you. When you walk in, they know your name. They know exactly what you're getting. It's a much more personal feel.
Caring for the people in our community with the personalized treatment they deserve. Read more about your cancer treatment options and the consultative process that makes Dr. Glynn's practice unique. Call 413-732-4478. Get the personal treatment and care that you deserve in a place that makes you feel like family. Meet oncology specialist Dr. Philip Glynn today.